Hello, good morning. Welcome to KNUST Desk. We're coming to you live from our studios in Kokomlemle. Coming up this morning, 10-day-old baby dies in a suspected case of medical negligence at KNUST Hospital when parents took him for circumcision. Also, demand for immediate governmental intervention to enable the provision of holistic care for mentally challenged persons increases as lack of human and financial resources continue to impede efforts by NGOs and the new public institutions working in the area of care. We have a special conversation on the prevailing situation. Plus 1 million Ghana cedis belonging to the University of Ghana locked up in NDK Financial Services. Details of that, including efforts by the university in securing accreditation for a number of its non-accredited academic programs, captured in the 2021 Auditor General's report. My name is Aisha Ibrahim. Do stay for details. Many thanks for choosing us. A 10-day-old baby has died at the KNUST Hospital in Kumasi in a suspected case of medical negligence. The baby was sent to the facility for a male circumcision procedure, but hospital sources say he suffered cardiac arrest and died few minutes later while in the care of the medical team. Ohimenteri of our health desk reports the situation has left the parents of the baby devastated.
On April 3, 2023, Mohammed Jamal and Halimatu Adams took their son, Faraj Mohammed, to the KNUST Hospital for a simple procedure, male circumcision. The baby was received by a nurse who took him to the theater for the procedure.
3rd April, no near Joadanopa. Na akulanya 10 days. Into Yadrin say, you're for circumcision. You jare akra no you ho den bibia ha no na de no call Tech Hospital. You de no call hospital no o chire theater ma ye call ho e ma nurse ne no abeje akra no hwe no nti oje akra no eyi ne diaper no e run atade hwe akra no hwe ne diaper hwe ne be ma ho nyina o hwe na o si bibia ye okay.
The wild cry of the baby was heard for the last time by the parents, who were then seated at the waiting area of the theater. Then, some senior nurses and doctors were seen rushing into the theater, a development which made the parents distraught. The baby's mother, Halimatu Adams, knew something bad had happened to the baby, but had to endure a long wait to hear news about her son.
Dr. Nekasa Kra, Mama Nan Kasensi, or Kasana, Nameka say, Gotcha said, Doctor, Gotcha me say me banu, because no my feeling say, I'm Pabibi, I am a pam.
The thought of losing their only male child and the bizarre circumstances has left the couple traumatized.
The feeling or the pain that you go through, unless you experience it, because it's something you cannot even express it. What you go through, the psychological pains, the trauma that you go through any night, when you hear the cry of the child, the pains and even you can't do anything, you can't focus.
Authorities at the KNUST Hospital have declined comments on the matter. The University Relations Officer says the matter has been referred to the legal department of the university. But a patient-centered non-governmental group is leading a campaign to bring justice to the Jamals. The Advocacy for Medical Malpractice Victims says it can establish a prima facie case against KNUST Hospital. Kwame Brobe Apia is the executive secretary.
From all indications, the hospital was negligent in the conduct of the circumcision. So we believe strongly that we will be able to establish a prima facie case against the hospital. The little checks that we have made with the hospital, the indications are that one, the person that supposedly conducted the procedure was not an expert in that field, and the person was unqualified to take up that particular exercise. Then again, we are also told that they actually did not procure the informed consent of the parents, because it's important to let them know the risk associated with the procedure and then any other outcome that they are likely to have before the process is done. That wasn't done. Also, from the investigations we have done, we know for a fact that they actually did not take the history of the baby before proceeding to, undertake the procedure. If that had been done, I am sure a lot of these issues would have been averted.
Checks at the Health Ministry indicate medical legal cases are on the rise in the country. In recent times, at least 2 medical legal cases are received every week, a development which has left Health Minister Kwaku Agyeman worried.
What I'm seeing of late in the ministry are issues of litigation. For the past 4 weeks or so, almost every week, we get at least one letter from the Attorney General's office. Somebody has sued somebody with problems with care, service delivery, and they want us to come with information for them to go to court with. Then we'll refer to Director General, or Kumabwaji. But I've been with you for the past 6 years. Earlier when I came in, those things were not happening that much. But now it's become something, it's just climbing, it's becoming very common.
From Kumasi, for Joy News, Oimeteria reporting.
Let's still stick on health because there's an increase in demand for an urgent government intervention to provide holistic care for mentally ill. Attempts by non-governmental organizations to complement government's efforts have been overstretched due to the immense need for human and financial resources. Reducing stigma and ensuring access to quality mental health care in Ghana remains a mission yet to be accomplished. Hannah Odame has been exploring the case of mental health care in this feature titled Minds on the Street.
Sometimes I feel very bad because some are very young and some are very old too, and some too, they are not clothing well, so sometimes you feel bad about it.
It is not only about how they feel, but the pain they can also inflict on anyone they come by.
In August 2022, a mentally challenged woman hit a man with stones at this particular spot. For those who stay and live around, it was a moment of reawakening. For how long are they going to tolerate or look over their shoulders when they see a mentally challenged person in their vicinity?
That torturous incident lingers on the minds of many who heard it, but most especially on the minds of those who witnessed that horrific act. The thought of being attacked, abused, or beaten by a mentally challenged person is an act no one would want to experience.
It's quite frustrating of late. I do meet them. Sometimes they come towards you whilst you are working, and you are a little scared, especially during the night, and you feel you should run away. And when you try to, they try to follow you. It is something which is really, uncomfortable. And I feel the government should, in a way, try to put them together in one place. Some are very threats to life.
That intervention to get them off the streets was announced on March 2022 by the then medical director of the Accra Psychiatric Hospital, Dr. Pinaman Apau. She revealed the redevelopment of the facility into a 220-bed hospital was under government's Agenda 111 program and and was part of many other projects, including the construction of 101 district hospitals, 6 regional hospitals, and 2 psychiatric hospitals.
The first date that was communicated to management was the end of June 2022. However, updates that I got recently from the coordinator of the Agenda 111 project indicates that currently they are doing what we call technical evaluation on tenders that had been submitted.
But almost a year on, not much has happened in terms of a pull-down and a facelift. One would think the facility hosting some of the mentally challenged persons in the national capital will be rid of their presence around their premises. But that's not what we see here at the Accra Psychiatric Hospital, with some of them reserving permanent habitations around this place. Passers-by and residents are uncomfortable.
We will feel very bad because it is not good for somebody to carry a stone and throw another person. Even the person is not a madman or the person is not a mad woman. You understand? We call it a little violence. It's something that is not good at all.
Former director of the Accra Psychiatric Hospital, Dr. Akwesi delves in on this development.
As at the time the idea came to pull down the structures and build new ones, we had got to the point where it didn't seem fitting for a facility of our age in Ghana. So the idea was to pull it down and rebuild it. All things were more or less in place, but somehow it's stalled. I'm sure it's not totally dead. I'm sure the plans are still there, that somewhere along the line, you'll get the funding to continue the program. That was it. Now, you mentioned 2 new psychiatric hospitals. Yes, one in the northern belt, one in the middle belt. As far as I know, they are still on the drawing board. Land has been secured, and they started building them. So we hope that funds will continue to be available for them to finish building them. And if they finish, it will be wonderful. Because for now, all our 3 facilities are down south.
As the nation waits to see the fulfillment of the redevelopment promise, we should have seen the completion of the redevelopment promise. The mentally challenged on the streets will perhaps remain, and the fears of many will also perhaps remain.
Some of them, in fact, they look scary, and I think it is not right to be walking on the way and maybe coincidentally you run through them, and then some of them, in fact, what they can do to you. And because he's a mad person or mentally challenged person, you can't take him or her to court or anything like that.
I am Hannah Odami for Joy News.
And back in the studio, my name is Aisha Ibrahim. I've been joined in the studio by Dr. Yao Amankwa Afa. He is the Deputy Director in charge of Health Promotion at the Mental Health Authority, and we're going to have a conversation on this. First, let's look at key strategies and considerations as far as mental health care is concerned in Ghana. Okay.
First and foremost, let me say a good morning to your cherished viewers. This report that you've just shown is a concerning issue. It's indeed a concerning issue. I mean, when you walk the streets of the major capital towns in our country, you find lots of them, and it's quite worrying. But we need to do something about it. We need to do something about it. It's becoming a security threat. So if you ask about the strategies that we are using to dealing with this situation, I mean, our current Mental Health Act asks us to move away from institutionalization to community-based care, whereby persons with mental health conditions would have more of their management and treatment in the community. Okay. So that being said, what it means is that we need to integrate mental health care as part of the primary health care.
Yeah.
Having personnel to be there to be part of the management. We have community mental health nurses who will go into the community to look after these persons, include their caregivers, family members, all part of the care for persons with mental health conditions.
What's the status of interventions, if I may ask? I mean, to check stigmatization of persons with mental health. Over the period, we've had cause to complain about this.
Well, stigma is an attitudinal problem that is more rife in our community. It's a deep-rooted problem. Stigma is about when you know. So let me set the story this way.
Okay.
If I should ask you that if you were to, or somebody close to you, a colleague, is experiencing psychological issues, what is your knowledge? Do you have appropriate knowledge? Do you have good attitude to support this individual to seek for care? Would you support that individual while that person is receiving care? That is the question I ask.
Okay.
If the answer is yes, fine. If the answer is no, then there's a bit of stigma there. Because you see the person and you think that, oh, you have your own problem, you have personality weakness and all that. That is the issue that we are having. So yes, stigma is not something that we can assess. It's by our attitude towards our colleagues, our family members and all that. Imagine somebody breaks the hand. All of you guys will go to visit that individual in the home.
Yeah.
But what if I say that I have psychological issues? You have your own problem. You have personality weakness. That is the stigma. So it's about time, and it's underpinned by lack of knowledge.
Yeah.
So until people get that appropriate knowledge, they will still express negative attitudes.
And then that's where I'm heading towards. Have you created enough awareness? Because if I have a colleague or I have someone closer who is showing some traits of mental illness, I may not even know because I don't know the symptoms, I don't know the triggers, I don't know what to look out for. But if I'm educated well enough, then I'll be able to pick some of these signals and not to stigmatize.
Yeah, that is very true. And with this awareness, it comes in different forms. We can do a whole nation whereby we'll show stuff on TV, on radio, and of course, you yourself will need to take that step to acquire that knowledge. When COVID came, we were not waiting for the TV. We were reading all over the place to get knowledge about it because it was scary. So it is the attitude with which we embraced acquiring the knowledge of COVID. Same way we should do with mental illness. Because look, I mean, for the statistics tell us that for every 4 people, one of them is likely to experience mental health conditions in their lifetime. Okay. And currently we have more than 350 million people globally experiencing depression. And the current dispensation is full of stress. Yeah. Work-life balances, relationship issues, the Ghanaian environment itself, traffic, religiosity, family issues, socialization and all that. All this is causing so much stress for us. Yeah. And stress, if you do not take care of it, would graduate into the psychological issues. Yeah. You get me? So for that matter, I would come down that if you are experiencing stress, you should not take it lightly. You should take steps to help, to distress, to help yourself.
Yeah. What are the steps to take?
Well, first and foremost, you need to know the triggers and try to avoid them. And when it becomes, for me, because if you do not have that appropriate knowledge, seek for help. Yeah. That is what I advise. You may take some steps that may not be helpful to you. Yeah. Some will enjoy drinking alcohol and taking substance. And they all end up on the street. Yeah. So if you are not sure, take steps. But there are simple lifestyles.
But what are the triggers? At what point would you think that I am stressed and so I need help?
Well, when more often when your mental capacity, you know that your mental capacity have dropped. You cannot sleep well, you cannot eat well, you become restless. Things that you used to enjoy, you are not enjoying it anymore. You cannot relate well with your colleagues. Yeah. You understand? Your work capacity, you know that you can read continuously for 3 hours. Now you realize that Now, you can't, 1 hour, you get tired and that sort of thing. Yeah. Mental exhaustion. The moment you begin to experience this thing, it should tell you that, look, you need some sort of help. And there are basic lifestyle changes that you need to sleep well, you need to eat well. You don't spend the whole night looking at everybody's status and responding to it when you need to be sleeping. Yeah. If you don't get good sleep, it affects your mental capacity. You get tired. You get tired all the time. So these are
as well.
So basic lifestyle changes. That is the first step. But when it graduates, then you need to seek for help.
I want to talk about how to foster the culture of acceptance. I mean, understanding people having mental challenges, and then having some empathy for them. But it brings back the conversation about awareness. You talked about COVID. Even COVID, that affected everybody. We were all scared. This is new. I mean, it's going to kill us. And so we all wanted to read something about it. But you want a third party to have empathy, to feel for someone close to them, and not to stigmatize them. They are two different things. So I want to believe that there should be a systematic way of actually imposing all of these on us, creating that kind of awareness. That also works. Instead of waiting for us to get up and go start reading about how to, get the triggers. If you have a colleague or a family member who is showing signs, what are the signs they will be showing? What should I do? How about you imposing it on us?
Imposing knowledge is quite difficult here. But what we need to understand is that each of us is at risk at any point in time of experiencing mental health problems. Yeah. And for that matter, how you want to be treated when you experience it, you should so in the same way extend that treatment to. That is the basic thing. Mm-hmm. That is the basic thing.
Whichever way you look at it, there must be some form of education.
There must be some form of education. That is when this opportunity came. I'm here.
Yeah.
You understand? So I congratulate you guys for doing what you do when it comes to mental health. Others are doing. But you need, as an individual, to arm yourself. That is the first thing. Because awareness, it takes a lot of money. You know that. Yeah. We have our financial issues. Government is doing so much to support us, but everybody's asking for money. Okay. There's very little that they can do when it comes to that. So with the little resources that we have, we are doing that. You understand? We go to schools to educate the students. We do virtual seminars that is open to everybody. We've trained a journalist to talk to people how to report on mental health issues, so that we would reduce the stigma about all this. So these are basic things. But if there is more resources, we could do more. If you decide that, mental health authority, every week we are giving you 5 hours to come and do education, we could. There are so many things that we could do with that. But of course, you're also doing your business, so you need to look at that aspect.
Well, it's a social intervention. Why not? Have you even tried that kind of conversation? I think it's something that we'll be interested in because it's for a good cause for the country. But also, you keep on talking about early intervention and prevention measures. Tell me about it.
Well, you see, mental health problems does not go away by itself. You need that professional help.
Yeah.
And the earlier you seek for that professional help, the better. Because if you seek for it, outcomes for you are better. Recovery is faster. Mm-hmm. Every little support that comes into the management and treatment from family members is worthy. If you wait and it gets worse, you would have to live here to go and visit that individual. It's costly because you are living. But when it's early, that means that you need only to talk to that person. For example, have you taken your medication? Have you done that? And that support helps in recovery faster. So the moment you realize that you have a problem and you seek for early intervention, the outcomes are much better and faster for you. If you wait, it will get worse. And as it gets worse, management and treatment becomes more expensive and more difficult.
And so if there is that intervention, early detection, or you find out that there's something like that. There's also what you call the personalized treatment.
Personalized treatment is when you've gone into the facility. You've gone into the facility.
Okay.
And doctors and nurses, the doctors have assessed you and decide that this is the plan, that this is the management plan they are going to follow in your treatment. That is personalized. If we suffer...
Is there a possibility of...
Of course, that is what they've been doing. That is what they've been doing.
That means that you don't have to be admitted at the
hospital. No. We are talking about community-based. So you go in, if you go in early, perhaps they would not need to admit you. Okay. So they give you the advice, the medication, whatever it is. But you have community mental health nurses who would come home to have a look at you and help in the management. It's all management to treatment.
We've been talking about educating the public. We've been talking about how we ourselves can take up the mandate, upon ourselves to read and understand what the triggers are and act fast. But we need to also talk about health professionals, those who give care to mental health patients. What's our situation as a country?
Health professionals in general, or mental health professionals?
Mental health professionals, and in terms of their training?
In terms of their training, I would say they are having the best of training.
Okay.
The numbers that we have issues about, because you've reported before that most of them are living outside to seek for greener pastures. And so that has reduced the numbers, increasing the burden of those here. But the fastest strategy is to increase their production. Of course, not forgetting about the quality. The quality will not be compromised on the training that they will receive. But the idea is to increase production from the training colleges so that they would close the gap with this training, yes.
So generally, what would be your assessment of mental health care in Ghana? Has there been an improvement, or we are having more people on the street?
I think last year or so, the Minister of Health reported about 16,000 people on the street. That is a huge number, and that is concerning. So for me, even if there is one person on the street, that is too much numbers for me.
Yeah.
You understand? That is too much numbers for me.
Okay.
Mental health in Ghana, yes, there is more room for improvement, but we've done so much. Years ago, you guys will not even have mental health issues to talk about. But here, we are talking about mental health. So through that education and awareness and collaboration with you guys, that is one bit. The passing of the act in itself, we are trying to, our current chief executive is more enthused about collaboration, bringing everybody on board. Because everybody is working in their silos. But if we all work together, the impact will be huge.
Yeah.
The impact will be huge. So that is what we are looking at. We are asking everybody that, look, if you are doing something about mental health, come, our doors are always open. Let's see how we can work better. So that asking me to come and negotiate for my 5 hours, of course, we are going to start that when we finish this program. So that is all that we are looking at this stage.
Let's look at the challenges. Funding is something we all know about. It's been one of your biggest challenges. What other challenges can you talk about? And has it gotten better in terms of funding?
Funding, I would say that, if we get more, we'll be happy with it.
Okay.
And
you are satisfied with what you have now?
I would not use, as far as if we get more, we'll be happy. If you are eating one
Oliver Twist ask for more.
It's an issue of an Oliver Twist ask for more. So yes, we are grateful for any that government does for us. We are so much grateful because every little helps. You understand?
Okay.
Yes. So financial issues, yes, that's the major problem because whatever you need in terms of medication, in terms of logistics and resources, even the producing the nurses, everything is money, you understand? And it's a system, but the money is what you need.
Yeah.
So if the money comes, all these things would be addressed. Yes, the challenges are there, but I must tell you that we are doing our best under the circumstance. And yes, the stigma is there, but I can say when you talk to people are more receptive to listening to mental health issues than previously. So that means that we've made some impact, we've made some significant impact, people embracing mental health. Attitude, stigma, it's quite deep, so it takes quite some time to uproot it, if you understand what I mean.
Yeah.
But at least we've made quite significant progress.
Well, this is an issue that we are all interested. We will support you all the way as you try to improve on mental health care in the country. We wish you all the best and thank you for the good work. Dr. Yamankwa Asa, he's a Deputy Director in charge of health promotion at the Mental Health Authority, and we've been talking about how to improve on mental health care. Let's get on to other stories, which also is in the health sector, because the Ghana Health Service says over 60% of the population has not fully taken the jab against the COVID-19 virus. The country is still far behind in achieving its COVID-19 vaccination target. The service says this leaves the country vulnerable to the virus. The Director General of the Ghana Health Service, Dr. Patrick Kumar-Boaji, who was speaking at the launch of the 7th National COVID-19 Vaccination Campaign, made this announcement. Listen.
Only 10.8 million of the population in Ghana have been vaccinated against COVID-19, representing 34%. 13.9 million have received just one dose of the COVID-19 vaccine. The Ghana Health Service is not happy with the development. The service has therefore launched the 7th edition of its COVID-19 vaccination campaign. The target is to administer 1 million doses of vaccines to individuals above the age of 15. Director of the Ghana Health Service, Dr. Patrick Kumar-Boaji, says a lot of work needs to be done to reach herd immunity.
Nearly 26 million doses of COVID-19 vaccine have reached almost 14 million persons, out of which 10 million persons are fully vaccinated. And as was said earlier, this represents about 59.4% of the target. While this is commendable achievement, the country is still far from achieving its national target. This means that the whole population still stands at a risk of a likely event of new variants as COVID-19 remains extremely unpredictable. And I must say, as you saw the program manager present, this total dose represents about 34.46% of the population. What it means is that almost 70%, or a little over 60% of the population are unvaccinated.
He indicated that misinformation is hindering many individuals from getting vaccinated.
Well, I think that's always been the misinformation and then the fear and then the low-risk perception. The low-risk perception are the thing that is going to happen to you, but not me. But what we have noticed is that when the vaccines are taken close to them, we are able to overcome that challenge. Because that's why we are doing outreaches to the people to ensure that even though they may not feel that they are not at risk, but if the vaccine is provided, they are willing to go. They may not travel to go and queue and have it, but if the vaccine is taken to them, and that approach has really helped us, and we continue enforcing that until we meet our targets that we set ourselves.
Manager of the expanded program on immunization, Dr. Kwame Amponsa Achiano, outlined strategies to attain the vaccination target during the campaign.
We want to deploy approximately 5,000 and over vaccination teams with over 1,000 supervisors across all the levels from national, regional, districts, sub-districts, using almost 23,000 healthcare workers and volunteers nationwide. We are aiming to vaccinate approximately 40 persons per team of vaccinators per day. And of course, we will ensure that these teams are visible.
The vaccination campaign is scheduled to kick off from July 19 to July 23. Esther Nkrumah's report read to you.
1 million Ghana cedis of money belonging to the University of Ghana is locked up with NDK Financial Services. This came to light during Tuesday's Public Accounts Committee sittings. Director of Finance for the university, Bernice Agudu, says the university has learned lessons and has since put in place an investment policy to ensure it does not happen again. She says they're working to retrieve the locked up funds. Listen to the interaction between the chairman of the committee, James Kluche Aveji, and the Director of Finance of the university.
So the university, that is the Office of Research, Innovation and Development. You invested in NDK Financial Services, and only 100,000 was redeemed, leaving a balance of 1,234,767.59 Ghana cedis. Have you been able to recover this balance from the NDK Financial Services?
Thank you, Mr. Chair. As a university, we have learned from our previous acts. We have
Will you answer my question first?
We haven't recovered the amount, but it's going through the process. Currently, it's with the legal counsel to follow up through the due process. We currently have an investment policy which confirms what we are saying, and we are adhering to that. So that is where we are.
Why is NDK Financial Services not able to refund the money or pay you the money? Is there any reason?
They had liquidity challenges, and what they told us when we sent it to them was they promised actually paying, but we never got the money. So we have followed our internal processes and handed it over to our legal counsel.
Are they still in operation?
Yes, to some extent.
To some extent means what?
I can't confirm their status as of now.
Then your answer, yes, should not be the case.
Okay.
I asked, are they still operating? You say yes.
I withdraw that. I withdraw that. The legal counsel will follow up with due process and inform.
It means that the legal counsel never follow up on all these issues. Now you are saying that they will follow up. They haven't followed up.
It's a continuous process. They sent a letter and they keep following up. But as the 100,000 was retrieved through correspondence as well. They have sent reminders. And I think we have attached a copy of the letter. It's a process which is ongoing. Thank you, Mr. Chair.
And while the university says it has taken steps to ensure accreditation of some of its unaccredited programs captured in the 2021 Auditor General's report, the 2021 Auditor General's report revealed 374 academic programs offered by the University of Ghana were unaccredited. Out of the 374, 14 are diploma programs and 80 are undergraduate programs. Postgraduate programs are 213 and 67 are PhD programs. The report stated that the university advertised 374 academic programs on the various web portals that had their accreditation expired or required reaccreditation during the period under review. But the university says it has accredited 60 out of the 80 undergraduate programs, with 20 still undergoing the process of accreditation. Listen to that interaction between chairman of the Public Accounts Committee and registrar of the university.
After we had these audit responses, we've put in place a lot of measures. So, for instance, currently we have a total of 132 programs, or should I say we have a total of 220 programs in the whole university. We have put in place measures to ensure that all of these programs are properly accredited. Currently, we have 132 programs which are fully accredited, Madam, and this cuts across all levels.
Madam, I'm sorry that I may come across as being rude, but I'm asking a specific question. But you want to give me a PhD thesis out here. 2021, the auditors came in for the undergraduate programs. 80 of them were not accredited. I'm interested in that 80 that was not accredited. What have you done about it? The 80 that you were audited and they were not accredited.
Mr. Chairman, what we have done is put in place systems to ensure that all of these 80 programs are properly accredited.
How many of them have you gone to get the accreditation for, the 80?
Mr. Chairman, out of the 80, I would say that currently we have 60 of the undergraduate programs fully accredited, and the rest are in the process of being accredited.
Now let's go to the next one, postgraduate. You had 213 programs that were not accredited.
Thank you, Mr. Chairman. As part of the process, we have weeded out many programs that were no longer being offered at the University of Ghana. So as I said, we have a total of 220 programs in all. So this figure of 213 postgraduate programs, half of them probably have been taken out because they are no longer offered at the University of Ghana, and the remainder have gone through the accreditation processes or are in the process of going through reaccreditation.
If you just joined us, this is Joy News Desk. Let's take a break and bring you business shortly.
Hi, good morning. Welcome to Business. My name is Dar Okwao. The Office of the Registrar of Companies, ORC, will soon roll out a software to assist and provide services to individuals with low literacy levels. The digital platform will also ease accessibility and patronage of services of the ORC. This was revealed at the inauguration of the ORC office complex in Kumasi. Here's more in this report.
The three-story building of the Office of the Registrar of Companies in Kumasi is to get closer to the business community and improve the quality of services provided to clients in the northern sector of Ghana. It cost 8 million Ghana cedis and was financed using internally generated funds from the Registrar General's Department and the Office of the Registrar of Companies. The ORC is responsible for registering, managing and regulating commercial enterprises. Registrar General Jemima Mama Owari says failure to digitize systems and processes at the office would be costly for the country. She says the digital operation will help phase out the activities of middlemen in transactions and access to services.
We acknowledge the fact, though, that we are in a digital era, and there are still some people in our society who unfortunately have not been exposed to this. This office will therefore have a specialized division to assist clients who generally have no knowledge in IT and require aid. But let me make a point here. It's not going to be that forever and ever you'll be coming here to get help. We'll help you once, and then you go and try and use the system yourself. So we cut out the continuous flow of human traffic to this place. With the assistance of the World Bank, this new software that I'm talking about will replace the current one, which is giving us lots of challenges currently. It's going to be migrated onto the G Cloud before the end of August, and I believe our services will improve considerably.
Ashanti Regional Head of ORC, Nana Mecha Prempe, says the inception of the ORC in 2019 has seen an increase in business and company registration in the region.
The digitalization process has helped because the turnaround time is quicker. It used to take about 3 months for you to get a name because we had to thumb through manuscripts to be able to determine whether this one has registered or not. But right now, at the touch of a button, you're able to determine whether this name is on a system or not. So it takes a shorter time for us to process documents.
The Attorney General and Minister of Justice, Godfred Yabua Dame, wants permanent offices of the ORC to be established in all regions.
I've stated before that effectively harnessed, the Office of Registrar of Companies possesses the ability to be a formidable organ for the state in the area of good governance and the fight against corruption. In this regard, it is an absolute imperative for the ORC to have permanent offices around the country. The ORC needs to be firmly established in every region and district of Ghana. The Kumasi office of the ORC, that ought not to be the last of the expansion drive of the ORC. I assure you of the government's support for the Office of Registrar of Companies to acquire its own permanent offices in all the regions of Ghana so as to improve service delivery and ease of doing business.
For Joy Business, Mona Lisa Frimpon reporting.
Now, with Ghana's economy seeing an exponential dip in recent times, there have been calls to develop strategic policies in supporting the patronage of green businesses and their products. Ashanti Regional Director at the Ministry of Trade and Industry, Mahmouda Osman believes the optimization and patronage of environmentally sustainable enterprises could shore up the sinking economy. He says the continuous dependence on imported goods would not only throw the country into economic difficulties but also threaten national security. Here's more.
SNV Green Regional Trade Show held in Kumasi, Ashanti Regional Director of Trade, Mahmouda Osman, noted the essence of embracing a green and circular economy through industrialization.
Under the Green Project, I have witnessed entrepreneurs come out with very attractive and useful products from waste. Some are producing raincoats, laptop bags, etc. from waste sachet rubbers, production of reusable sanitary pads, fertilizer from cocoa husk, charcoal briquettes, organic compost, among others. Global economy is sinking for various reasons. One major factor that makes Ghana's economy to struggle is lack of adequate industrialization, making us dependent on imports.
The food exhibition entitled the Sustainable Trade Investments, the future for the Ghana, was in partnership with the Ministry of Trade and Industry, GIZ Ghana, Association of Ghana Industries, and Ghana Enterprises Agency. The trade show brought together over 50 green businesses from SNV's Green Incubation.
All right, and that's it for this segment. The news continues after the break.
Welcome back to Joy News. Next to the rest of our stories, majority in Parliament for the first time since the NDC started boycotting Parliament over Jachukwesin's trial proceeded with business despite the absence of minority MPs yesterday. The House took questions, laid papers and discussed statements. Although the House fell short of considering much weightier businesses like bills, it's a significant turn from the past when it just adjourned the House whenever the NDC group abstained from sitting. Majority Chief Whip Frank Anodompre had a clear message for the NDC. Parliament of Ghana cannot wait for you. Listen.
Our colleagues in the minority, and they have elected not to be present. So that the Parliament of this Republic cannot wait for them. And hence, as often been the practice, want to appeal to you that the answers to these questions be published, except for question 1405, which stands in the name of the Honorable Vincent. So for Speaker, it's your leave.
Among the key business the House considered was a statement from the Food and Agriculture Ministry on the debt owed suppliers of the Buffer Stock Company. According to the minister, the suppliers will be paid by the end of midweek.
Buffer Stock has made payments in respect of 2017, 2018, 2019, 2020, 2021 in full. Mr. Speaker, in 2022, of the 726,617,881 Ghana cedis, 500 million cedis has been paid to the suppliers. We still owe suppliers a little north of 203 million Ghana cedis. Such release, Mr. Speaker, we've sent to Finance, and last week we received 100 million, which is 50% of what is due the suppliers. We have transferred same through the processes to Buffer Stock. We're hoping that, Mr. Speaker, by the midweek this week, that 50% will be sent to suppliers. Mr. Speaker, I have also assured the suppliers that by the 17th of August, as we commence the payment of the 50%, 17th of July, by the 17th of August, the remaining 50% will be paid. Mr. Speaker, we have kept faith with the Buffer Stock suppliers. As I mentioned, the total business that they've done with the Buffer Stock Company is to the tune and exact 2,705,500,000 408,476 cedis and 58 pesos, 2.7 billion, out of which 2.5 billion has been made. And we will pay the remaining, the 200 million that is submitted to us in full by the end of August. We commence payment hopefully by Wednesday, and in a month's time, the total payment will be made. We don't have challenges with the suppliers, so we are extremely surprised about the happenings in the last 2 weeks, but we take it in good faith and we continue to work with them.
You heard the Greek Minister Brian Champo ending the news at 10 on Joy News Desk. Or log on to myjoyonline.com. There's more of the news over there. And the headlines you would see: KNUST Hospital cited for alleged medical negligence as 10-day-old baby dies during circumcision. You would also see caregivers call on government to holistic health care for mentally challenged persons. My name is Aisha Ibrahim. See you again at 12.